So if we want, or if it's okay with everybody, we can have a moment of silence. Okay, so are we ready to get started?
Recording in progress.
Okay, so it is a little after 5:30 and I will call this meeting to order. Mary, do you have a call? Yes, I do. So, Dottie, do you want to lead the pledge? And then we're going to... I pledge
allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay. Lord Jesus, once again we thank you for this time that we can spend meeting, and we ask that you bless this time and give us wisdom, give us strength, give us guidance. And Lord, we also continue to pray for William's family and be with them in their time of loss. This we pray in the holy name of Lord Jesus Christ.
Amen. Okay, so just a thing. I feel very much sad and sorrowful that we are here. Anyway, I thought that this that the deal that Bob Bonner wrote in the paper was very was an honor to William, and so I wanted to read that. So this is, Bob wrote it, so it's from his perspective. My relationship with William Curley, a dedicated public servant who passed away last week, is a reminder of why finding common ground even after sharp disagreement matters. William and I spent years on opposite sides of some very contentious issues while he served as Weston County Attorney. I challenged a number of his prosecutorial decisions publicly, and I do not have second thoughts about the positions I took. Those were serious matters and disagreement was appropriate. What I do regret is allowing some of those disagreements to become personal. It was not a calm or easy period, and I have to confess that I allowed myself to become angry over decisions I believed were questionable. William, by contrast, never seemed to take my objections personally and maintained a level of pragmatism about our relationship that I did not always match. I have since benefited from the passage of time, a change of scenery, and a growing relationship with Jesus Christ, which allowed me to mature and understand that people are always more important than issues, and that today's pressing issue may fail in comparison to tomorrow's. Despite our clashes, William and I always agreed deeply on at least one foundational principle: government transparency. That shared value ultimately mattered more than our disagreements. When he was appointed to the Weston County Hospital District Board, I was pleased, not because we suddenly agreed on everything, but because I knew he had pushed for greater openness. He did exactly that. Under his tenure, the hospital board reduced its reliance on executive sessions significantly, from 48% of meetings in 2024 to 34% in 2025. That change did not happen by accident. I believe it happened at least in part because William believed the public deserved to see how decisions were made, even when those decisions were difficult. William Curley was a public servant who genuinely cared about this community and proved that time and again. Weston County mourns the loss of his service. The Newcastle Journal mourns the loss of a reader, and I personally mourn the loss of a friend, even if we were not always on the friendliest of terms. While we differed strongly over his role as a county prosecutor, I am grateful that William never closed the door to working together on issues where we did find common ground, because he did not allow disagreements to become personal. We continued to speak over the years and were able to collaborate on a number of issues. His passing is a reminder of something we would do well to relearn. Political enemies today should be able to be political allies tomorrow, and even return to being political adversaries on the next day, depending on the issue. That is not hypocrisy, that is maturity. We are better as a community when our leaders analyze issues on their merits, not through personal grudges or rigid loyalties. And we are better as citizens when we allow room for people we disagree with to still be people of integrity. William was a third side guy. He showed that it's possible to stand firm on your positions while still working with those who challenge you and to do so without anger. We honor his memory this week by committing ourselves to do the same, to seek common ground where it exists, to disagree without hatred where it does not, and to remember that our shared humanity matters more than winning an argument of the day. And anyway, I really did appreciate William and his willingness to hear all the issues, the sides of issues, and not hate you if you disagree. So, anyway, I certainly will miss him. And so if we want, or if it's okay with everybody, we can have a moment of silence. There's also a card here. I don't not know his children at all. So I don't know. Denise got two cards, one for his wife, and then if we wanted to use the other one for his kids, we could.
We'll probably have to have Amanda get us the address.
Linda had told me yesterday or the day before that his son was coming this week. So maybe, so if we want, we can just.
We will send that to her.
So I don't know how to address it. Okay, are we ready to move on to it? Are there any additions or changes to the agenda?
You want what did you say to your kids?
Yes, we did. Okay. Does anybody have any additions or changes to the agenda?
I make a motion to approve the agenda. The only changes will be that Paul won't be here, so I'll do my best to give his financial report and rely on Carrie to finish up any other stuff I might have got.
Is that an official change? That's an official change.
Yeah, because he's not gonna be here today, so.
Okay, so with that change, is there any other things that we'd like to change? So Dottie has, we approve it, does anybody else have, does somebody want to second that? Okay, thank you, Jeff. Okay, so it's been moved and seconded, any discussion? Okay, all those in favor of, on the agenda, say aye. All those opposed, same. Okay, it's been, agenda is approved. Okay, so now on to the minutes. Did anybody have any changes? I thought I had seen somewhere when I looked at it earlier, Ben was spelled wrong.
I fixed
it. Okay, you fixed it, okay. Did I have any copy? Is there anything else besides that? It's already been fixed? Bless you.
Madam Chair, I make a motion to approve the minutes of January 15th, 2026.
Have a second?
I'll second.
Okay, it's been moved and seconded. All those in favor of approving the minutes, say aye.
Aye.
All those opposed, same. Okay, the minutes have been approved. Okay, visitor comments. We have any visitor comments?
Thank you for reading Bob's editorial on that. The obituary has come out in this week's paper, and as obituaries go, it's really wonderful, so I would recommend reading that.
Is he having services? In April. Okay, so we're just have to keep an eye out for that. Okay.
Yes, I did hear about that there's going to be like a memorial service for him. I think at the lodge, if I'm not mistaken. But anyway.
She told me April.
He will be missed. Big time.
Okay.
Yeah, who's gonna make sure our language is right?
I know.
I need to come up with a change to the agenda just to.
Yeah.
Yeah.
You'll have to rely on Allison now.
Madam Chair, may I comment as a visitor? I just wanted to let the community know about my experience with Keisha in radiology. My father-in-law had to have a scan, a cardiac scan, and it was scheduled in Rapid City. And when I called there to reschedule it, I said, can this be done in Newcastle? And she said, I really don't have any idea. So I sent the order over to Keisha and said, can this be done in Newcastle? And it turns out it was one of the scans that can be done with our new machine, with the cardiac add-on that we had purchased and as part of the new machine. And so, to make a long story short, we got it all scheduled, and my father-in-law went, and he was more of a test case for you guys, and he was very excited to do that, and he had a very good result from it, and everybody, it was just exciting to be part of the new machine and the new scan. So thank you for that, and I just wanted to bring it up in case the community should need any type of cardiac scan in Rapid City. They should check with Keisha first to see if it's something that can be done with our new machine. So
Thank you.
awesome. Thank you.
Okay. Any other visitor comments? Okay, well, let's move on to quality.
Good evening, you bet. So I'm gonna go kind of through the infection prevention stuff pretty quickly because it's kind of the same. The beginning is kind of the same as last month. None of those numbers have really changed as far as influenza vaccination rates for the facility and the COVID vaccination rates for the facility. They remain seasonably low with a small spike noted this month, and one admission was COVID related on the acute care side for January. Long-term care infections for the month of January were 5 out of 51 residents, 4 were UTI related and 1 was respiratory related. And we've been in a norovirus outbreak status since February 2nd. We had surveilled a total of 15 residents. Many were roommates, but were under surveillance because they were exposed. And so we had a total of 6 residents that were actually ill with the symptoms of norovirus. We did test 1 resident, and that resident did test positive for norovirus, so pretty much you can bet that everybody else had it. So we're out of outbreak status now. All the signs I took down, so we're out of outbreak status now. So everything is going good over there. And for employee health and safety, workers' compensation claims for calendar year 2026 so far are 3. No lost time from work days. I'm tracking incidents of verbal and physical threats and escalations of violence has begun. That's what I've begun tracking. Starting with January, 2 reported incidents to date. And then Donalda presented a training and discussion on our Reflex Protect that we have stocked in various departments around the facility. Reflex Protect is a simple, effective, non-lethal solution designed to incapacitate a violent perpetrator. And so Donalda did a bunch of training with everybody. So we really appreciate that.
I have to say, you know, while everybody else is thinking about running for election and how to do that, we have a budget. We have a serious budget. We have a legislature that has weighed in, I think, on one vision of Wyoming. And I think it's very important to be thoughtful. And let me say, not a legislature, a joint appropriations committee. But that's the job I have. That's what I was elected to do. And I'm not, when I always tell this story. So Dad told me to go water the chickens. And so I spent the entire morning figuring out a way I didn't have to carry the pails of water over to the chickens. And at noon, he said, "So, did you get the chickens watered?" And I said, "I got this really cool thing, Dad." And he said, "But I told you, go water the chickens." And I think I've got that job. Make sure that we get through this budget session. Thank you.
And for quality, Group B of the Quality Committee met. The following are departmental reports of progress for PI projects. Tammy with Emergency Preparedness reports on security analysis. There was a security analysis performed on Monday, which would have been the last Monday. When the results are made available, she'll share and a report will be made to the board regarding what they found. She also discussed monthly and quarterly drills as well. And then Suzanne presents information on continuing to monitor the medication severity index and barcode scanning, which was at 91.5% in January, and her data is ongoing right now with that PI project. Kim reports on the various tags and plans of corrections. They are awaiting state to arrive to do another survey for correction. Several PI projects came about due to the tags that were assessed on the facility during that survey, and Kim has more information on that she'll give you when she's updated. Marketing, Charlotte reported on the ongoing data she's collecting regarding employee engagement and satisfaction, and the plans that she has to increase engagement and satisfaction. Her project is also ongoing. For business office, Marcia reports on the number of open charts she currently has and is collecting data for a new PI project as she's moved for quality team. And then for our quality data, we had in January transfers out of the facility for January of 13, with 10 going by ground ambulance and 1 by private vehicle and 2 by flight. Manor transfers for the month of January were 2 with no admissions, resulting in that. For ED readmits within 72 hours, there was a total of 6 patients. 4 were seen twice. 1 patient was seen over 5 times with admits to EDs and surrounding areas as well. And 1 patient admitted to the acute care ward. In our incident reporting system action queue, we've seen an increase in medication documentation errors coming out of long-term care, and plans are in place for additional medication administration education by Melissa, who is tracking these numbers as a PI project. So she's kind of in charge of that. That's her new PI project. And then for compliance and risk, updates to the HIPAA notice of privacy practices go into effect on 2/16/26. The next med staff meeting is on the 24th.
Is that you?
No, all I wanted to apologize for missing the meeting.
That's okay.
No disrespect.
No,
I just
not taken.
fumbled my schedule.
It's okay. Not a problem.
So, I should know this answer, but who goes to the med staff? So,
I'm not sure for sure. That's what I
I think it is really goes
I think that's, yes, med staff, not even my staff. So, that's on
Yes, and we are having, Ben East from Monument Health is going to be bringing a physician from Rapid City. He's a cardiac electrophysiologist, and he's going to do a little presentation right before med staff is rolling. So it'll be kind of exciting to see what he has to offer and what he does.
What time was it?
Starts at 8 a.m. on Tuesday.
So, anything else for Polly?
I'd just like to thank Polly and Rinaldo for starting about the safety for employees and patients and family. It's much appreciated.
And we do have more as far as for the,
That's covered.
okay, so now we're up to
In case you didn't see it, I've got our 5-star rating. The most notable change on it is our staffing. Last time there was 1 star, it's back up to 3-star. We just resubmitted a PDJ, it was due February 14th, so that'll be reflected next quarter as well. I don't know if I gave you enough copies, so here's another handful just in case. You need a couple more? I'll just give you my full stack, how's that sound? That works.
I think everybody's got one.
Yeah, I think so.
Unless, yeah, I got one.
Current census is at 52, our occupancy rate is at 89. Payer mix, we've got 31 Medicaid, 6 Medicaid pending, 12 private pay, and 2 VA. We didn't have any admissions in January. If you recall, we were on that admissions hold. And we did have 2 discharges in January. One was to the community, one discharge to the community, and then the other was a discharge to the depot, unfortunately. Current agency staff, we've got 6 CNAs, 2 RNs, and then 1 LPN, and I do believe we have another LPN coming. State survey, they were just here, actually, that's why I was late coming in. They cleared us of all of our deficiencies. So we are back in compliance, so I have to just reach out to them and make sure, because we've been cleared, if we have to wait for our letter from the state saying that we can take admissions again, or if we can start taking admissions right away. We do have a gentleman that we've been putting off because we run admissions only because of Medicaid insurance. And so that part of that was we couldn't accept Medicaid residents. So once we get to go ahead with that, we'll bring this gentleman in.
That's good news.
Yeah, so I'm really excited about that. And then the other news that I have is Melissa resigned. Her last day is going to be March 13th. The director of nursing. Melissa Thomas. When is your last day? March 13th.
And who do you have working as interim?
So I have Tammy Dowdy working alongside Melissa as interim. So we're still recruiting, but Tammy's also starting to apply, so yeah. Any questions at all?
The Medicaid, or not the Medicaid, the pending ones, how are they?
So they are coming along. One of the Medicaid pendings, one of them that was discharged, she was a Medicaid pending. So she has fallen off. They're still in progress. We're probably going to have to skip others though.
And we have one we're waiting on probate because they died, so they have a home and stuff, so
Yeah.
we'll wait on that one to be able to get. And their son is aware of that, right? He knows that we're going to do that. So we're getting there, it's just a slow process.
Okay. Any questions for Keith?
Did you say Melissa's last day was
March 13th.
Okay, thank you.
I would just like to say thank you to Kim for working so hard on trying to get us back into compliance for long-term care. She did a wonderful job designing the plans of correction, and so I just want to give her a really good thank you because she did great.
Thank you.
And hired a chef in the meantime too. That's good.
I was wondering about that. I was really here. Yes.
Oh,
That's
there
right.
it
That looks awesome. Yes.
He's working out great. He's
Yeah. residents
He's
have good things to say
kind
about the food, so.
And the staff is enjoying it.
Yeah.
Yes, they're really excited.
Yes. Yep, I believe he's just living in an RV type situation right now, so yeah, he's here, he's embedding himself, so. Yeah. Very good.
What is his name?
Chris Jones,
We call him Chef Chris.
Chef Chris, yes.
And he wears a chef
Chef's coat.
coat and everything, so we're like, we have a chef.
Does he have a hat?
Mhm. Well, I didn't see the hat.
He
but,
doesn't have the big white hat, not that I've seen him break out yet, yes. We gotta let him get more comfortable.
He's really super kind. He's nothing like Ramsey, Gordon Ramsay, so.
Is he from around here or is he from
So
somewhere
he
else?
came to us from Jackson Hole, but I think he's kind of been a little bit all over, just kind of doing the resorts and I think Arizona, he's been in Arizona, so.
He's done long-term care too.
Yeah, so he's been in my summer, so, yeah, we're happy to have him, that's for sure.
Oh, very good. Okay.
This is on the.
It does smell good.
It's making me hungry.
And that's not easy to make a salad smell delicious.
No.
Okay, Rebecca, we are on to you.
Or we can go to Trista, because Trista's actually on.
Oh.
Well, because she wasn't here, but she ended up being online. Trista, did you want to talk?
I am, sorry I'm not present. You guys had a little bit of a procedure done today. Patient volumes are 198 more than we were in 2025, which is really good. We are starting to cross-train. We have a nurse that's going to be going out on FMLA in April, and so we are starting to already push proactively the training and getting the staff engaged in what she is doing currently. Our schedules are pushed out through the month of June. We have started to teach servant leadership, which you can kind of see in the handout that was loaded about how we can step in and start to engage better with our staff and trying to support them. We've had a lot of staff that have experienced some personal needs this last couple of weeks, and I'm very proud of the team that we have. They rallied around these people, and it was a great thing to watch. We did find out this last month through the care with ANOVA that our rural health care claims have not been being correctly coded. This ties all the way back to when the hospital purchased the clinic from Monument Health. So there has been a major revenue leakage since that time. The correction that I would make was we purchased that clinic in 2019. So there has been leakage over 6 years, and now those claims are going out correctly. The rules were fixed and loaded, and we're monitoring those very closely and haven't seen any issues or problems. We do have a new AI intelligence that is being captured in both acute care summaries from the physicians as well as the clinic physicians, and so there was a new form for consent of treatment as well as to be in compliance for billing, and we have attached those to your information as well, and that is now loaded, and patients are now being able to sign those. We do have copies of those at the check-in desk and readily available to distribute once they are signed if anybody has any questions with that. Any questions so far before I keep going? The clinic in Upton has seen a little bit of a downtick. We are seeing about 54 patients a month right now, so we've moved our days to Tuesdays and Thursdays to see if we can get our volumes to come back up. Hopefully we'll be able to sustain that and move back into our volumes where we will see in 68 to 75. Dr. Haverly gave his presentation yesterday at the senior center. We had about 30, a little bit less than what we did, but I'm going to attribute that to a lot of the elderly people are starting to distance just because there has been a lot of sickness in our community. We did finish our staff recognition wall, Kathy does have a picture of that, and it looks really nice. We have all of our providers up there, our nurses, as well as our frontline team. We did get lighting for each one of the patient rooms, actually so before when the power would go out, we weren't able to continue to treat patients even though we have downtime reports because we don't have a backup generator. And now we can continue that with the lighting that we've gotten. Let's see. And one of the great things that have happened is that we've started to cross-train the front office to do pre-authorizations, and they are working with Amanda, so that is freeing up a lot of the nurses when we have pre-authorizations that need to be done for CTs or anything like that. And it's been working out really well, and it's just shown that we can actually have a good cooperation. One of the things, and it's a shout out to Keisha and Radiology again, we were experimenting with the ABMs, the Advanced Beneficiary Notifications. They were not firing when a patient would come in that a diagnostic code would not meet the criteria. And so now, because we are producing these, we are able to have a modifier placed on the claim, which allows us to bill the patient if Medicare does not pay for that. And that is a huge win for us. It allows the patient to choose 3 different levels. They can either bill the way that we are billing with modifier, they can choose to not have the procedure, or they can just basically say, I want to go a different direction. And so that's automatically scanned in. And so it's a really good thing. And I just wanted to tell Keisha how much I appreciated her partnering and working with us when we were discovering all of that. Other than that, thank you. Do you guys have any questions? Everybody's doing really well over at the clinic right now.
Questions? Thank you very much. Rest up.
Thank you.
Okay. I'm on to Rebecca then. So, since my report, I'm happy to tell you that by March, you'll have my, just a copy for educational purposes of the I-9 audit. March 4th and 5th, the employees that have deficiencies in their I-9s, or they're missing one completely, or some documentation or whatever, they will be meeting with us on March 4th and 5th to supply that. And my emails went out to them today, so it's about time. It's kind of quieted down a little bit lately, so trying to dive into some new things and fun things. So Dawn went yesterday to the job fair at the high school, and she signed up for one at the college in July next month. So that's happening, and I have some new policies, and I'm waiting for an approval on one. And I just submitted a new one that Kathy has, to approve still for job shadowing and interns. So policies is what I like to do, so now that I'm getting time to dive into that more. So. And lastly, I plan to present a proposal today for new HR payroll software. I had to get that recorded, so that will be in front of you next month. But I will make sure you have all the information. We're paying an extremely high amount for 2 different softwares. So we have 2 different ones speaking to each other, doesn't work. So I worked with Paul briefly on that, and Emma, and doing a lot of demos. And so we have a software that's all in one, doing everything we have now. And it's I think, I want to say we're saving maybe $15,000 or something like that. Paul
I don't think you guys have talked to Wendy yet, right?
I have.
You have, okay.
Yeah.
And I just don't want us to go through a collaborative conversation with our management team. So
Yeah.
we're not quite ready yet, but yeah, right. I agree. Thank you.
Yeah.
to say thank you to all of you for sending these reports over in advance so I could really sit down and read them beforehand and then pay attention to you while you're speaking, and I appreciate that very, very much. So thank you to all of you.
Denise cracked the whip.
She did.
Thank you, Denise.
Not too hard. Use the wet noodle.
Very good. That was really helpful. Okay,
So our current census today is 4. We had some discharges and he had to go to the manor. He was sick pay, but he was able to go to the manor last week. We had a total of 20 admissions in January. 13 were acute care, 3 skilled, and 4 intermediate. Observation admissions were 11. And the emergency room saw 168 patients. The number of referrals I've been receiving has increased from Monument. I probably have a couple a week. It's just a challenge sometimes with trying to pre-auth their insurance and, make arrangements. And sometimes by the time all that gets done, then they go home or another facility kind of beats me to it. But it takes up a little bit of my day to do that. And our census remains stable, so we had no low census for our staff this last month, which is always good. There were 7 cardiac rehab patients for January, so that was a good increase. We were able to get a new treadmill, so now they can have a couple patients at a time instead of just one at a time, so that lets them increase their patient load. The AI for the discharge summary and Epic for the providers is going over very well. They all really like it. They just have to hit a few buttons and it pulls all the information from the chart and creates a discharge summary for them. And then of course they have to review it, make sure that they agree with the information, they can edit it, and then they can just sign it. And then it's very handy for them, and they all love it, of course. Staffing this last month, I did have a long-term nurse resign, Michelle Keeb. She was a night shift nurse full-time. She has resigned. She will be done March 31st. I have another nurse that's kind of filled in those night shifts. I'm just going to see how we do with maybe not replacing her, but I may need to bring in a traveler if we can't find a full-time nurse. And then I just have 1 full-time travel CNA on my staff right now. Everything else is full-time or part-time people. So, and as I'm the manager for EBS, I did hire a young gal to clean the clinic. She was doing a couple hours a day just to clean the clinic. I've since moved her up into full-time status as a housekeeper, and Bill McCrank has moved into the clinic position. The discussions about safety are ongoing. As it was said, we did the Reflex Protect education. And IT has been able to give us another computer on wheels, so a cow, that we use in the emergency room so the nursing staff can be between the patient and the door. So that increases their safety, so they're not kind of trapped in the room if the patient becomes violent. And that was it for that. And then we did have state, like Kim said, we had state come in. They actually came in on the acute care side as well. They came for an EMTALA violation. I don't have any results. They say that when they come for an EMTALA, they just gather information. That information goes to CMS, and then it goes to physicians, back to CMS, and then we will get a report. So they said, don't worry if you don't hear anything for 2 months. So it'll be a couple months before
We'll
we
forget before they get it here.
Mm-hmm.
Yeah.
What they did tell us was a couple things that they noticed. we don't have proper EMTALA signage in our ER. And then there was some transfer forms that Dr. Franklin should have signed behind the mid-levels. So those were two things they did identify that they could tell me. But as far as the result of the EMTALA investigation, I don't have any information. And I'm still tracking discharge vitals on ER patients for my QF.
Well, we don't do those I haven't even remembered an EMTALA survey before, just strictly for EMTALA.
I guess this is our second one. First one Kim said we had was the patient was told to go.
So we had a patient, I don't remember what time of the year it was, we had a patient in the ER that needed to be transferred to a higher level of care. Rapid was on divert, Campbell County was on divert, Wyoming Medical Center, all of the hospitals around us were on divert. This patient really needed to get out. The provider discharged the patient by private vehicle and said, you need to go to Campbell County. If you go to their ER, they can't turn you away. We ended up not having an EMTALA violation with that. They didn't call that an EMTALA violation, but that is what triggered the EMTALA investigation, and that's been 83 years ago that happened.
Any other questions for Ronaldo? So do we know what signs you guys need to put up then? Okay. Like,
They were nice enough to
Tomorrow?
show us what
Okay.
we needed. Actually, Polly was in the Deadwood ER with her dad on Christmas Day. And she took a picture of their signs and she came to me at that time and said, you know, we really should have these in our ER. Well,
And then everything
Yeah.
got rolling for the end of the year and beginning of the year for all the yearly submissions, and so we just got busy and never thought about it again.
so we know exactly.
It was you that called the feds on us?
So, yes, we're working on that as we speak.
I have all the pictures of everything that's been
okay. Any other questions? Okay, well, Kathy, we're up to finances. Okay, so let me, sorry, just organize myself. Put them right there. Okay, you have your papers, and I've got some bullet points too, so let me, if I make a mistake, Carrie, slap me into the right position, okay? But, first of all, I thought I would tell you, I got today a note. I just got our total cash piece. We have unrestricted cash of 1.143925 of unrestricted cash. And we have 4.297092 of what we call restricted cash. Because it is, we can restrict it from unless we want to use it. So a total of net cash of $5,441,000. Okay. So patient revenues grew by 15% this month over month, and fee projections by 2%. Revenue deductions decreased by $719,000 from contractual obligations claims time. So it had to do with claims timing, expected to ebb and flow throughout the year. We had a low amount this time. Other operating revenue grew by 70% month over month. There was an increase in interest income of $6,300. January beat expectations by over $16 million due to negative projected outcome.
I probably heard what that meant.
Negative projected outcome. So, because we had a negative in January, we put a negative number in there. And so we were said we were gonna lose money. We didn't lose money, and we actually made more money, so we're ahead of the game a little bit. That's what that's really means. It's a good news. We thought we'd lose it. Because last year in January, we were pretty slow. This year, we weren't as slow. So, okay, on the balance sheet, there was an increase in cash and cash equivalents of around $690,000, and a decrease in accounts receivable by $450,000. However, we're still looking at accounts receivable because I still think it could look better than it does right now, in my opinion. So I still think there's some talking I need to do myself with ANOVA to see what we can go with it. And then especially for anything 61 days and above. So decrease of current liabilities is approximately $1 million. Let's see if I can remember why we did. Yeah, the liabilities are just down by $1 million. That's catching up stuff that we needed to get caught up.
So what they got that, you know, where you send them a certain amount of money and then they send you back more money. So we got the pile of more money and we used it to pay a lot of bills.
Yeah, exactly. That's the bottom line. Yes, we paid a lot of bills, and we're doing it again. We have another one for $104,000 or something like that.
That's not right.
Yeah, $104,000, and or it seems like it was more than that. Anyway, we have another one. We're putting it on the revolver, and then we'll get the money back and pay the revolver right away. And this time we won't have as much taken out from that revolving account. The first time you had to have $10,000 taken out plus the percentage that we pay for it. This time it'll only be a little bit of money based on a short turnaround time on.